Hi, good afternoon. My name's Lauren. I'm the head midwife at Mama Baby. I've been a midwife for 15 years and a childcare specialist. I have 4 children of my own and 6 grandchildren. 2 of the grandchildren, one I delivered as a home birth and the second one I assisted delivery. From the UK, after my experience, I came to the UAE and practiced in a couple of the hospitals, and now I'm head midwife, clinical educator and parent support advisor for Mama Baby. The main topic that we're going to talk about today is the perinatal care. There are a lot of women that need support out in the community. It's Mental Health Week, so we're going to highlight on that and the reasons or how or why this happens to many women. So firstly, it could be the anxiety of pregnancy, especially for expat women that are out here. They have no family support, maybe even the partner's travelling backwards and forwards, so they feel lonely, emotional, anxious because there's no one here to support them. And the supports in the community, they need to go and get the support rather than the support go to them. In the UK, we provide the support throughout continuity from antenatal right to postnatal to up to 6 weeks. They could be suffering from mood swings, anxiety, sadness, feeling overwhelmed. For a first-time mum, it is overwhelming to know that you're going to have a baby and how am I going to cope? What support am I going to have? Can I afford to have this baby? So they're overwhelmed, crying, they have trouble sleeping, trouble eating. It could be from a complicated birth or complicated pregnancy, traumatic delivery, problems with breastfeeding, baby not latching, crying baby, or the most common question that women have, or what they say, the comment that they say is, I haven't got the milk. So you do have the milk. The best way to help you and stimulate your milk is at 37 weeks pregnant, massaging your breast, stimulating the areola. And then at birth, skin to skin, whether you have a normal delivery or you have a cesarean section, the World Health Organization and UNICEF and LaLeish recommend skin to skin. So as soon as baby's born, baby's placed on your skin in between your breasts, and you have to be hands off. The nurses and midwives have to be hands off and allow the baby the good hour, the golden hour. So in this process, while baby's laying here on your chest, baby will cry, baby will move, baby will smell, familiarize himself or herself, and crawl right or left. Just like any other mammal, we're the only mammals that interfere with the lactation process, and we need to start to learn to leave the babies alone for a good hour. Anything that needs to be done for baby when at birth, vitamin K, weighing, can be done later. If baby's well, baby can stay on skin to skin. The paediatrician can come to mum, listen to baby's observations, heart rate, check baby over. But if baby's active and alert, let's leave baby alone. Leave baby alone, leave mum and baby to bond. So while this process is going on, your baby's regulating its heart rate, its respiratory rate and temperature. They say dads can do skin to skin. Yes, dads can do skin to skin for thermal regulation. But remember, while baby's in utero for 9 months, baby recognises mum's heart rate, mum's respiratory rate and mum's smell. So mum is the best place for baby to have skin to skin. And this way it initiates the lactation process. So massaging at 37 weeks, skin to skin at birth, either whether it's a normal delivery or cesarean section. Initially baby will go over to the resus for cesarean section, but once the paediatricians check baby, baby can go on your skin to skin in theatre. and then it's continued in the recovery area for the good hour. When baby falls asleep, you fall asleep. Okay, you rest. When baby rests, you rest. That's your time. So a lot of women will talk about, I'm not sleeping, my baby's crying, I'm exhausted. Take the opportunity. When you're breastfeeding, when you're lactating, you're breastfeeding baby, find a supportive chair. Get a good chair, get your cushions and relax and enjoy. There's nothing worse than sitting in the bed or in the chair and you're not relaxed. Baby can sense that you're anxious. So you need to relax and be at calm. Okay, and get a good position, because also you're going to get shoulder and neck pain if you haven't got the positioning right. And then that way, baby also will get a good latch and a good position and start suckling. And remember, initially, you say you haven't got milk. Day 1, day 2, day 3, it is colostrum. Allow baby to get the antibodies, the good colostrum. And from there, the milk will start to come in. You will feel the milk come in. You will feel the letdown, the breasts that start tingling when the letdown comes in. Another question, poor attachment, sore nipples, inverted nipples. We can help. We can help with this. We are a home-based company that can help with lactation process. We provide in our antenatal classes the lactation presentation to help and assist. Also, we provide a service where we can come out to you and help you with the lactation process. We talked earlier about postnatal depression or baby blues. There is a difference, but we need to remember it's not only mums that have the postnatal depression and the baby blues. Fathers do too. So we do have a daddy class. We provide a daddy class to educate and train fathers perinatally through the process so that they can help and support you through your pregnancy and after postnatally. So the father can support the wife with taking care of the baby, changing nappy, bathing baby, even feeding baby. So if you're breastfeeding and you're expressing and storing the milk, fathers can take over. They can feed the baby while you sleep, while you get that extra sleep. So there's help there for fathers, and this is another thing why we are initiating the daddy classes, to show them and guide them how they can support women perinatally and postnatally, and actually even intrapartum. Preparation is comes back down to education. So you need to educate yourselves or get the education from a service provider such as ourselves to make you fully aware of complications or things that could happen in pregnancy or in labour. So both you and partner need to go to an education programme to support yourselves so you are aware of any issues that could arise. She could also gain support not only through the home care. We will pick up, because we provide a postnatal wellness service. So we can pick up the signs, and when we talk to you, when we're assessing you, we're doing a holistic assessment. So we will pick up and your concerns will be raised, and we can direct you in the right direction to get the help and support for postnatal depression out in the community. There are many services out there in the UAE. Yeah. Yes, some women do not want to admit or afraid to admit because of stigma in the community. But the symptoms are mood swings. You're irritable, you're anxious, you're sad, you're crying, you can't sleep, you're not eating. So these are some of the symptoms. There are many more symptoms. The list is so long, but when a home care provider such as ourselves, Mama Baby, come to you and we do the postnatal wellness assessment, we can pick up on this. I'm an experienced midwife. I can pick up on signs and symptoms, and we can ask you open questions to find out how you're feeling, what your thoughts are with regards to baby, and then we can refer you to relevant services to assist you. Okay, what can we do? So we can support you in the community. There are home-based companies that can support you. So it's a case of you going out and finding these companies. Why would you have this anxiety? I mean, you could have it generally perinatally, but you could also have it postnatally. If you don't have one, you could have the other. So our service is Mama Baby at City Walk. So please feel free to come along or give us a call, and we will educate you in the process of perinatal and postnatal care in pregnancy.